Good afternoon, everyone. Thank you so much for joining me today. I'm Jennie Montgomery. Welcome to another half hour of information to help you make informed decisions and to keep up with goings on around Greater Augusta. Today, our friends from the Aiken Women's Heart Board are back to tell us about this year's annual benefit. It's always a lot of fun, and it raises money for such an important health cause. But first, another important health issue, obesity. Today, we're talking about weight loss surgery. It is a life-altering procedure that has shown to be effective at reducing the impact of many obesity-related conditions, such as type 2 diabetes, sleep apnea, and heart disease. Obesity is one of the top health concerns in the country, especially as studies are now showing your body mass index could actually impact how long you'll live. Meredith Wood explains.
You may already know that being overweight comes with a slew of health issues that can shorten lives. But new research shows that being underweight increases the risk of dying early too. BMI, or body mass index, is one indicator doctors use to measure a person's health. BMI between 21 and 25 is linked to the lowest level of morbidity. Interestingly, people under the recommended BMI are at an increased risk for dementia, Alzheimer's, cardiovascular disease, and suicide. The study analyzed data from 3.6 million people and over 360,000 deaths. Obesity was shown to reduce lifespan by 4.2 years for men and 3.5 years for women. And what's worse, if this trend continues, obesity will be the most common cause of cancer in women by the year 2043. That's according to Cancer Research UK. To reduce your risk of developing any health condition, it's important to keep your body mass index in the healthy range. You can do that by getting proper nutrition and incorporating exercise into your daily routine. For today's Health Minute, I'm Meredith Wood.
The CDC website shows that in 2016, the obesity rate in adults over age 20 was just under 40%. The percentage over 20 years old who were overweight, including obesity, was a staggering 71.5%. Even more incredible were the percentages of child obesity. From 12 to 19 years old, it was over 20%. And in those only 2 to 5 years old, nearly 14%. Data from the National Health and Nutrition Examination Survey showed that from 2013 to 2016, nearly half of adults in the U.S. tried to lose weight using diet and exercise. And in the last decade, the number of Americans undergoing weight loss surgery has steadily risen. The American Society for Metabolic and Bariatric Surgery reports that in 2011, 152,000 people had surgery. By 2018, that number was up to 252,000 people getting bariatric sleeve or gastric bypass surgery. Up next on Jennie, meet an Augusta woman who had weight loss surgery 2 years ago. Her candid account of why she did it and how her life has changed since losing nearly 100 pounds. We'll be right back. Kim Vickers is one of our associate producers here at News Channel 6. She's a busy mom of two, wife, college student, community theater performer, and she is a bariatric surgery success story, having had the procedure in December of 2017. Take a look at some of these pictures. Here's Kim before her weight loss surgery. You can see her pretty smile, but that's hiding a lot of frustration because she was bigger than she had ever been before, even heavier than her pregnancy weight. And take a look now. That's Kim and her husband before surgery. They've both had surgery, and take a look at this. In December, together they have lost right at 200 pounds. And I am so pleased to have Kim with me here today in the studio. And Kim, thank you so much for suggesting this story idea about weight loss surgery. She came to me and she told me about her story and thought that would make something really interesting for our audience. And I completely agree. And, you know, Kim, you had two girls, you had a husband, you have all your stuff that's going on. What made you even entertain the idea of weight loss surgery? How did that get started in your head?
I had spent a lot of time trying to lose weight the traditional way with fad diets, counting calories, exercising, trying to cut the bad stuff, and no matter what I did, the max I could lose was about 15 pounds, and then I would just stop, and I just could never get over that hump, and it just, like you said, I was frustrated. I just built and built and built, and I knew I had to do something because I was just getting bigger. I couldn't keep up with my kids. You know, it's really hard to play with kids. They wanted me to jump on their trampoline, and jumping on a trampoline is a lot more exercise than you think it is. And so I couldn't do it for more than a couple of minutes, so I just couldn't keep up, and I was missing out on a lot, and I was miserable. I hated buying clothes. I hated looking in a mirror, and it was just, I was miserable. So this was really kind of a last resort for me. I knew a few people that have had the various types of bariatric surgery, so I talked to them. I did my research. I went in and spoke to my doctor, and it took me about 2 years of research and thinking about it to actually make the decision to do it. But once I did, it was the best decision I've ever made.
How old were you when you had the surgery?
It was 2017, so I was 37.
37 when you had the surgery. Was it your doctor who then says, you know, let's get you in with a bariatric surgeon? Do you have to have a referral, or do you just pick up the phone and call and say, I want to come and talk about this?
In my case, it was a referral. I spoke with my primary care physician, and you know, she knew about the issues that I was having losing weight, and it just wasn't getting any better. So she recommended Live Healthy MD and Dr. Blaney, and so she referred me, but then I had to still go ahead and call, and I called and I made the appointment.
Was it something that insurance was friendly toward?
In my case, yes. It was fully covered by my insurance, all the different aspects, except for the psychiatric evaluation, which every patient has to go through. So that was out of pocket, but everything else was covered by insurance, thankfully.
You know, I think it's because this epidemic that our society is experiencing, this obesity epidemic, and I guess that maybe more and more insurance companies are seeing this as really preventative, because we know of so many other health issues that are created from obesity.
And the surgery actually will cure a couple of these issues. It will cure diabetes in a person if they've got, I believe it's type 2 diabetes, you know. One of the types of surgeries, and I don't remember which one it is, you go in as a diabetic and you come out of your surgery no longer diabetic, because it handles the issue. Because it's led up to because of the overweight, the obesity.
Now, you talked about your daughters. What did they say? Were they aware of the change, your physical change?
They definitely were. They were, you know, they were older. They were in the elementary school. My oldest, I believe, was in the 5th grade. So they knew what was going on. I try not to hide things from my kids because, you know, I try not to shelter them from things. So they knew that, you know, mommy was definitely overweight and that she was doing what she could for her health and for them. And I made sure that I let them know that I was doing it for me, but I was also doing it for them because I wanted to be around longer. That was one of my fears, that something was going to happen, you know, that I was going to have a massive, you know, health issue that would take me away from them, and that was one of the things that prompted me to do it. So, you know, I let them know that I was doing it to be healthy, so that I could be around longer, so they knew what was going on.
How do you feel like you are encouraging healthy habits in your kids?
Since going through everything that I had to go through, it's a very long process to get to the surgery. You don't just go in and say, hey, I'm gonna have the surgery in a week. I mean, it takes months to go through, and you learn a lot of healthy habits. You learn about what is good to eat, what is not good to eat. He says if it swims, walks, or flies, or comes from something that swims, walks, or flies, you can eat it, and if it's green, you can eat it.
Okay. So swim, walks, or flies, or it's green.
Yes.
Okay.
So I learned a lot of healthy habits, and if we're being real, I have not followed every little healthy thing. You know, I've made mistakes, I've slipped up. That happens, you're human. But if you really just do your best to stick with that, because it is a lifestyle change. This is not an overnight magic thing. I mean, you do see people, the weight just melts off of them, but you have to keep it up because it will come back if you don't. If you don't.
And your husband had the surgery a year later.
He did, and he's lost 100 pounds, and I joke with him that he's become a gym rat. He's in the gym every single day.
Isn't that great?
And he loves it. He's about to run his second 5K since the surgery, and he looks fantastic. He
That's
looks so
awesome.
good. He's doing very well.
Well, we saw that picture of you two together, and that was most impressive. All right, Kim, thank you so much for sharing your story, and I want you to stay with us because we're talking with Kim's bariatric surgeon, Dr. Michael Blaney, right after the break. Live Healthy MD is a comprehensive medical and surgical weight loss clinic specializing in the treatment of the obesity epidemic, what we've been talking about today. Dr. Michael Blaney is a weight loss surgeon there, and Kim Vickers, who you met in our last segment, is one of his patients. Dr. Blaney is board certified and a fellow of the American Society for Metabolic and Bariatric Surgery. And Dr. Blaney, thank you for being with us today.
Well, thank you very much, Jenny.
This is definitely a very important issue because of the obesity epidemic in our country.
Yeah, absolutely. Unfortunately, most of the patients that we see or you go see your doctor for medical problems are directly or indirectly related to an individual's excess weight.
Well, that's what is so interesting to me. Kim was touching on this also, is the number of obesity-related problems that we have, and how a weight loss surgery can help reduce so much of that.
Yeah, losing weight through any means, whether it be a non-surgical approach or a surgical approach, almost always, if not cures, significantly improves an individual's ongoing medical problem.
Okay, so what you said there is very important because you have people who diet and diet and diet and exercise, and they can lose weight or maintain their weight, and then you have others. When do they know they've reached a point where they're just like, I can't do this?
Yeah, that's a very subjective question, but I guess in general the way I would answer that is that obesity is a disease. Unfortunately, we're starting to recognize it as such. I think for a long time, as in society, particularly us as doctors, we've probably treated patients that this problem is more of a social problem.
I was going to say, or you're lazy.
Right,
yeah,
exactly.
There's a big stigma with it.
Absolutely,
yeah.
And that's very discriminatory because these patients, particularly patients in the upper weight ranges, truly have a hormonal metabolic problem. And what we're recognizing is that these surgeries, in particular the gastric bypass and an operation called the duodenal switch, diverts food away from the upper part of the intestine that seems to result in changes in hormones that regulate our metabolism. So there are individuals that can eat anything they want, and we know who those people are, right? And we have those individuals in our life right now. They eat all the junk food, all the candy,
and we don't like them.
And we don't like them.
They are not
That's
our
right.
friends. No.
And well, they're lucky. For some reason, they have a hormonal balance where their body can metabolize what they're eating. And other individuals, I call it just a sensitivity to carbohydrates. The basis of every diet, and I don't care what we call it, Jennie Craig diet or the Atkins diet, is really all based on one simple principle of reducing our carbohydrate intake. And some people, I think, are just metabolically more sensitive to carbohydrates than others. And to restrict your intake of carbohydrates to such a degree that you're going to effectively lose weight becomes not only
challenge.
physically impossible, but probably even metabolically impossible for those individuals. And that's really where surgery comes into play, is those individuals who have attempted to lose weight through other non-surgical means want to explore that option, and we're happy to have that conversation.
This is something that clearly you are very interested in. You even switched, you were general surgery, but then you began to focus on bariatric.
Yeah, so I trained in general surgery and had a very vibrant general surgery practice, but like most things in life, we tend to gravitate to the things that we find interest in, and that tends to promote our own values.
Yeah.
And it's very rewarding seeing patients who couldn't walk, were in wheelchairs, and are now walking and get their life back.
Kim told us that you have had people who come in who came in with type 2 diabetes, but after the surgery they don't even have that.
Yeah, that's true. Almost everybody we see, of course, is probably being treated for some medical problem. The most notable weight-related medical problems that we see are diabetes, high blood pressure, elevated cholesterol, arthritis, and so forth. And almost all of those problems, if not 100% cured, significantly improved, even through a modest reduction in weight. I tell my patients, you don't have to lose 100% of the weight you perceive yourself needing to lose to have 100% improvement in your overall health and quality of life.
Well, now what is the timeline from someone who either they're general physician, their family doctor recommends them for this, or can they just call you at your office and say, I'd like to talk about this?
Yeah, so there's various points of entry. I'd probably say half of our patients are referred directly from their primary care doctor. They're being treated for those ongoing medical problems, and their doctor says, hey, look, we're not really getting anywhere fast. You really ought to consider an aggressive more form of losing weight. So in our office, we practice both surgical and non-surgical treatment approaches. We pride ourselves in being comprehensive.
Okay.
And then about the other half of patients we see, come from direct referrals, usually off the internet. Patients go to our website, become educated, and request a consult. Either way, we're happy to have that conversation with patients, and it can be, very informal, coming for an informal seminar and just learning more about
and you do offer
these treatment
seminars
options.
like that,
Absolutely.
right?
So we have various dates and times at the different facilities that we practice at, and or if a patient does wants to go a more formal route, they can request a consultation and make an appointment.
How long, if someone has this surgery, how long are they going to be out of commission?
Yeah, so one of the myths, and this is what I talk about a lot when I am counseling my patients, the myths of weight loss surgery. In the old days, open surgery was a bigger deal. Nowadays, with laparoscopic, I don't know, some people call it laser surgery. It really has nothing to do with lasers, but TV camera surgery, much like taking out somebody's gallbladder, which many of your viewers have already had done. All these operations are done laparoscopically. Patients are in the hospital 24 to 48 hours, usually at the most, and are recovered in a week or two.
Wow. You can contact Dr. Blaney's office, Live Healthy MD, and the phone number 706-922-0440. You'll find so much information on the website. It's livehealthymd.com. They have offices in Augusta, Macon, and Dublin. So, Dr. Blaney, you've certainly given us a lot to think about today. Thank you so much.
Appreciate your time. Thank you very much, Jennie.
Certainly. And we'll be right back.